Namaste. I am Dr. Shaima Kazri from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about montenggia fracture. So let's start. The montenggia fracture is a fracture of the proximal third of the ulna with dislocation of the proximal head of the radius. It is named after discovered by a person named as Giovanni Battista Montenggia. The causes are there may some mechanism include as fall outstretched hand with the forearm in excessive pronation, hyperpronation injury, the ulnar fracture in the proximal one third of the shaft due to extreme dislocation, depending on the impact and forces applied in each direction. Degree of energy absorption determines pattern, involvement of the radial head, and where often soft tissue occurs. Direct or back of upper forearm would be a very uncommon cause. In this context, isolated ulnar shaft fractures are most commonly seen in defense against blunt trauma, example, nystagmus injury. Such an isolated ulnar shaft fracture is not a montenggia fracture. It is called as nightstick fracture. The diagnosis is classification is done in the four types depending upon displacement of the radial head. One extension type, 60%, ulnar shaft angulate, anteriorly extend and radial head dislocates anteriorly. Second flexion type, 15% ulnar shaft angulates posteriorly, flex and radial head dislocates posteriorly. Third lateral type, 20% ulnar shaft angulate laterally, bend to outside, and radial head dislocates to the side. Fourth, combined type, 5% ulnar shaft and radial shaft are both fractured and radial head is dislocated, typically anteriorly. These are known as pedotypes. The management of montenggia fracture is may be managed conservatively in children with close reduction, resting, and casting, but due to high risk of displacement causing malunion, open reduction, internal fixation is typically performed. Osteosynthesis, that means open reduction and internal fixation of ulnar shaft, is considered the standard of care in adults. It promotes stability of the radial head dislocation and allows very early mobilization to prevent stiffness. The elbow joint is particularly susceptible to loss of motion. Prognosis. In children, the result of early treatment are always good, typically normal or nearly so if diagnosis is delayed. Reconstructive surgery is needed and complications are much more common and result poorer. In adults, the healing is slower and result usually not as good. Complication of ORIF surgery for montenggia fracture can include non-union, malunion, nerve palsy, and damage. Muscle damage, nerve damage, arthritis, tendinitis, infection, stiffness, loss of range of motion, compartment syndrome, audible popping or snapping, deformity, and chronic pain associated with surgical hardware such as pins, screws, and plates. Several surgeries may be needed to correct this type of fracture as it is almost always very complex fracture that requires a skilled orthopedic surgeon, usually a specialist familiar with this type of injury. So this was all around about the montenggia fracture. Hope you understand it well. If you have any queries related to this video, ask me in comment section. This video is powered by digital version of 2.0 Jayoti Vidyapeeth Women's University. Namaste. खुश रहिए.